Hi there, my name is Jonathan Pichelle. I'm a nurse up here at Ivinson Memorial Hospital in the PACU. With this video, it'll show you what to expect for your upcoming procedure. Once you and your surgeon have decided on a surgical plan, you will be contacted by the OR scheduler. They will set up a pre-procedure phone call, time, and date for a nurse to call you. You will receive a telephone call from an Ivinson PAT nurse 1 week prior to your scheduled procedure. Please have your list of current medications and supplements ready to review, as well as a pen and paper available to write down important information. During your PAT interview, the nurse will inform you of the date and tentative time of your procedure. We will review your allergies, current medications, health history, and anesthesia history. After reviewing your medical history, we will determine the need for any further testing or medical clearances. The nurse will notify your surgeon if medical clearance is required and arrange for the clearance. After the nurse gathers your health history, we will explain what you will need to do to prepare for your procedure. For example, we'll inform you when to stop eating and drinking, which medications to take and which to stop prior to your procedure, and any equipment you will need to bring. The nurse will explain where to check in and what to expect the day of surgery. Please keep in mind, if you are planning to go home after your procedure, you will need a responsible adult of at least 18 years of age to transport you home and stay with you for 24 hours after your procedure. You will need to provide their name and relationship to you, as well as a telephone number that can be reached. The nurse will inform you that you will receive a reminder call the day before your procedure to review instructions, answer questions, and to inform you of any time changes. Upon arrival to the hospital, you will check in at the admitting desk or possibly ER admitting. The greeter will verify the reason for your visit and confirm your date of birth. They will then escort you to a private office. At this point, a patient access representative will go through all your demographic and insurance information. Once completed, they will place you in the waiting room with your designated clipboard. Next, a nurse will escort you from admitting to your pre-op room. Welcome to the pre-op area. This is where we will prepare you for your procedure and where you will meet your surgical team. Once in the pre-op room, your nurse will ask you questions regarding your current health and health history. Many of these questions have already been asked. However, to ensure accuracy and consistency, they will be asked again. Your procedure consent and anesthesia consent will be reviewed, and any questions you have will be answered. After consents have been signed, you will be asked to change into a surgical gown. Vital signs will be taken, any additional testing will be done, and an IV will be placed. You will then meet your anesthesiologist and your surgeon prior to your procedure. At this time, we will provide an explanation about the procedure and the anesthesia process that's about to take place. After your preparation is complete, you will meet the operating room nurse, who will ask you a few more questions and take you to the operating room. Next, you will be escorted back to the operating room by your circulating nurse. Once in the operating room, you will see many members of our surgical staff. They will help you get into position onto the operating table and cover you with warm blankets, place monitors, and make sure you are secure and comfortable. When you are securely in place, your anesthesiologist will talk you through the anesthesia process as it happens. Throughout your procedure, our staff will monitor your vital signs and position you to ensure safety and well-being. After your procedure is complete, your anesthesiologist will begin the waking up process. You may not remember any or all of this phase in the process due to anesthesia. You will then be transported to the recovery room, also known as PACU, by your circulating nurse and anesthesiologist. They will stay in the room with you until monitors are placed and a report has been given to your recovery room nurse. The nurse will do an assessment and continue to monitor your vital signs as you are waking up from your procedure. If you are having pain, nausea, or any other problems, please let the nurse know. Family members are typically not allowed in the recovery room. If you are staying in the hospital, you will be taken to your inpatient room after recovery. If you are going home after your procedure, you will be transferred from the recovery room to your pre-op room. This is also known as phase 2 or step down. This is the phase of recovery where you will prepare to go home. The process involves vital signs while you sit and stand, assessing nausea and pain control, and emptying your bladder prior to being discharged. Your nurse will go over your discharge instructions with you and your responsible adult. This includes things to look out for and what to expect throughout your recovery. Once all these objectives have been completed, you will be discharged home. follow-up phone call in the days following your procedure will be made to see if you have any questions and concerns. We hope this video was helpful for your upcoming procedure. We can't wait to see you up here at Ivinson Memorial Hospital.